morning, y'all. It's Voluptuously Skinny. And this is actually my post-op week update. Oh, what week is this? This is 168 and 169. So, yeah. So last week I was 151.8. This week, yesterday, honestly, I don't even know if I recorded it. I don't remember what I was. I'll have to wait this morning and see. I think I might have been 156 yesterday. I can't remember. I'll wait this morning and look. But y'all, today is my surgery day. Yes, it's my surgery day. So I washed with that soap last night, and I didn't want to put on any. They told me to get in clean sheets and all of that stuff. So I didn't want to put on a whole bunch of clothing. So I just got in the bed. So, but anyway, today is the day for my abdominoplasty, my Fleur delis abdominoplasty, and my what do you call it? My brachioplasty. So excited, nervous. Yesterday, I think I was losing my mind, very irritable, but that ain't really nothing new, honestly. So anyway, I gotta be there at 5:30 this morning. It's about 4. What time is it? It is 4:15. So my son Doc is taking me this morning, and my sister, she's supposed to meet me up there, her and her fiance, her boyfriend. So, and I've had a lot going on. I'll tell you guys about that. Either sometime this morning I'll kind of tell you guys about it, or I'll share it with you on another day. So a little bit of stress, unintended stress, unnecessary stress, very unplanned. But I'll tell you guys more about that. I'm going to get up and use the bathroom and start getting ready. And then we'll see. Okay, so I'm about ready. We're going to be leaving here in about 10 minutes. I have just dressed kind of casually. It's the black little dress. I definitely put on some tights. And then just a little sweater, because it's cool out. And then I'm wearing flip-flops. Yeah, so something easy that I can get on and off going and coming. Tonight I have after surgery, I will be spending one day in the hospital. And that's about it. I'm trying to make sure I have everything. So let me give you guys a quick rundown about some things that have occurred just right before surgery. So I don't know, you guys may have heard me talk about my sister that had the stroke, and part of my healing from my whole breast reduction complications was forgiving my sister, Shiana, who was supposed to help take care of me then. And so over the course of these months and years and what have you, I have learned to forgive her, and had been allowing, having her come over to the house when needed, and what have you, just to help take care of her, because she's pretty independent, but she does need some assistance. My youngest sister had power of attorney over her and was her main caretaker. Well, on Monday, I get a call from Shiana, and she tells me that she needs me to come pick her up. So I go pick her up, and I hope that you guys can hear me okay, because I'm kind of talking low. I really don't want her to hear me. But she asked me to come pick her up, told me that she needed to take a shower. And I said, what happened? I said, did you have an accident? And she said, yes. Because with her stroke, sometimes she has mobility issues, and so sometimes she doesn't make it, or if she's stressed. So anyway, I go to the day center in which I thought she attended, and she's not there. So I call the number that she called me from, ask for that address, and I go to that address. And I pull up, and I'm thinking, okay, is this the day center where she attends? Because the other day center was saying, no, Shiana, there's no Shiana here. So I was thinking, well, maybe that's not the right one. So there were just a lot of vagrant people outside. And then when I walked inside, it was like jam packed to the hilt. These people looked like they had on every stitch of clothing that they owned. It was just a mess. And I was thinking to myself, there's no way that this is the place where they say she's doing arts and crafts and she's just loving it and she calls it school. And so and then I was kind of thinking, even when I pulled up outside, I was kind of thinking it was the difference between and not to be funny, but the difference between like a kinder care daycare and a Pookie's Place daycare. That's what I was kind of thinking, maybe that it was just a difference. So, and not to say there's any difference in care, because Pookie's Place, my sons have gone to a Pookie's Place, and that was some of the best care in the world. But you can tell the difference between the two. So, went inside, and like I said, describe what I saw. So I asked the lady that was up the front, I said, what? I said, do you have to pay for this? And she said, no, it's free. And so I'm still looking around like, okay, is this the adult day center that they've been sending her to? So I asked her, well, what is this? And she says it's a homeless shelter. I was too outdone. I immediately started becoming upset, and just my whole thought was, let me find my sister and get her out of here. What I found out later was that my youngest sister basically just got tired of caring for her, pulled up at the homeless shelter and told her to get out. So she had been at the homeless shelter for 3 days. And Saturday, Sunday, Monday, for 3 days. And the only reason that I even found out is because she doesn't have a telephone. She didn't know anybody's phone numbers. She said that this phone number kept going around in her head, and she told the lady, she says, the lady was asking her if she had any phone numbers, and she said no. And so she said, I do have one number that's in my head, but I don't know who it belongs to. So she called that number, and she said, and you answered, talking about me. So that's how she got in contact with somebody. Kind of makes me tear up just to even think about it right now. But yeah, she had dropped her off at the homeless shelter. She had been there for 3 days. They sleep on the floor. And, but nevertheless, that wasn't the kind of stress that I needed, a couple days prior to this major surgery. But anyway, she's living here for the time being, and trying to get her back on track. And then we're eventually going to, as soon as I get better, try to get her in like a residential home setting where she can be more independent and not be taken advantage of, which is what was going on. So anyway, I'll tell you guys more about that. We are getting ready. It is 4:57. I have to be at the hospital at 5:30. And the hospital is maybe 15 minutes away. I live on 71st, Lewis and 71st, and the hospital is like on Lewis and, well, not Lewis, but it's like on Yale and 61st. Does that make sense? I live close to Lewis and 61st, and the hospital's on Yale and 61st, so it's only a couple miles down the street, really. So anyway, but we're going to try to get there early. What's funny, though, is that my surgeon has not accepted payment yet, or has not taken payment yet. So I have come prepared to pay this morning, just in case. The hospital just called last night and finally did their payment, because when I went to pre-op last week and was trying to pay, the lady said there was nothing in there that showed that I needed to pay. So I just asked her, could I please pay the hospital stay? And so I was able to do that. trying to think of what else. So I paid for the hospital stay. I paid for anesthesia. I paid for the facilities fee, which is the hospital. Pre-op, they were going to charge me that, and that was like $950. And I told her that that wasn't the price that was the price that I was initially quoted, but the price that I told, I said they told me it would be much cheaper because I'd already had my EKG and blood work done by my own doctors. So the facilities fee was like $3,600 or $3,700, and anesthesia was $1,600. But with anesthesia, if you're not in the operating room, as long as the number of hours that you pay for, you get a refund. So anyway, let me get out of here. I'm so nervous, y'all. My stomach. Oh. So anyway, my stomach. And I woke up and I had to poop this morning. And I was thinking, oh, Lord, I'm going to contaminate my whole body again. Not that it's that bad, but anyway. All right, y'all. I'll check in at the hospital. Just checked in for pre-op. I'm waiting to do the urine test and all of that good stuff. Gosh, I hope that you guys can hear me. I don't know if you'll be able to or not. I should have I had my headset, but I couldn't bring really anything in here with me. The only thing that I actually brought was my spirometer. But my son is here with me. Say hi. Hey. Yeah. So, yeah. But now we're just waiting for a urine test, and we'll see what happens. Okay. I get to try the bear hugger. I've been wanting to try one of these because I see it on YouTube and Instagram.
Oh, yeah?
Yeah. And that is so neat. Yeah.
You want to take that home?
I know.
Here's
so
your
cool.
control. So to make it warmer, just turn it to the right. I got it set all the way over.
Okay. And if I want it a little cooler, if it starts to get too warm?
Yeah, just turn it.
Okay. This is so neat. It's the bear hugger. I get my own controller. That's awesome. Okay, so everybody around me is going into pre-op. My son is asleep. He's over there resting. My sister hasn't shown up. I don't know if she's running late or what have you. But I don't know if you guys... I think I got it wiped off really good, but they had me do a mouthwash, and they also had me swab my nose up high and then down low with 4 different swabs. And then they have me in a heated gown. I'm all puffed up. See? It's like I got big chi-chis. But I'm all puffed up. And they say that's all about preventing infection. I got my heparin shot, and I am ready to roll. I'm just waiting for Dr. Kunkel to come in and mark me up. And then my son will step out for that, of course. I'm not even sure if he'll mark me up here or in the operating room or where. But I will keep you posted. Well, if it's an operating room, I won't, because my phone won't be with me. So I will keep you guys posted. Usually my markup for my breast surgery was in the waiting room. And I remember those pre-op rooms. St. Francis is a much bigger hospital, and so we're all kind of in cubicles just separated by curtains. In the other hospitals that I've gone in, I've had my own kind of private pre-op room, so it was a lot better. So you know, hear everything that was going on around you. So what have they done? They've also taken blood. They have put different bands on me, allergy, and then sleep apnea, which of course I don't have sleep apnea anymore, but they said that they'll keep a closer eye on me because I've had sleep apnea before. And and my IV, I got my IV in my hand. I didn't drink a lot of water yesterday. So and they're really great about how they stuck you and everything. So nothing really hurt or anything. And I guess that's it. They'll take my glasses, take my phone in a little bit, and we'll be rolling in, just ready to get it done, ready to go to sleep, wake up, and have a flat tummy and no arms. I can't believe it, y'all. I can't believe it. So, and then yesterday, oh my gosh, yesterday when I ran, my stomach was so irritated, and I was just like, Lord, please don't let it. I was thinking it was going to be so irritated that it might even prevent me from having the surgery, but um, I guess it's okay. But while I was running, it was just same old thing, just chafing and that irritation and rash underneath with sweating. And so, anyway, I'm excited not to have to deal with that anymore. Super excited not to have to use those creams. I looked at those creams this morning and thought, prayerfully, I will never have to use those again. So, anyway, that's it. I'll keep you posted. I'll check in, hopefully, maybe after surgery during recovery, but we'll see. Talk to y'all later.